Governor Romney, your chief economic advisor, Glenn Hubbard, who you know well, he said that Romney care was Obamacare.
The truth is, our plan is different, and the people in Massachusetts, if they don't like it, they get rid of it. Right now, they favor it 3-1. But I'm not running for governor of Massachusetts. I'm running for president of the United States, and as president, I will repeal Obamacare.
That was Mitt Romney's latest attempt to distance himself from the Massachusetts health care reform law and from President Obama's 2009 affordable health care law. Romney's comments follow a report from NBC News Michael Isikoff released yesterday that revealed the extent to which the Obama administration consulted with the architects of Romney's health care law when developing their legislation. The records gleaned from White House visitor logs reviewed by NBC News show that senior White House officials had a dozen meetings in 2009 with 3 health care advisors and experts who helped shape the health care reform law signed by Romney in 2006. One of those meetings on July 20th, 2009 was in the Oval Office and presided over by President Barack Obama, the records show. Hours before last night's debate, a reporter asked Romney to respond to the report that his aides advised the Obama administration on health care reform.
Actually, I don't believe they were aides. They're people who were consultants and so forth. But I'm sure the president got lots of ideas. But the one person he should have talked to that he never talked to was me. And if he had talked to me, I'd have told him that the plan he was crafting wouldn't work.
One of Governor Romney's health care reform consultants was MIT economist Jonathan Gruber. He attended 5 of the 12 meetings at the Obama White House in 2009, including the meeting with the president. Joining me now, professor of economics at the Massachusetts Institute of Technology, Jonathan Gruber. Thanks for joining me tonight, Professor.
You bet, Lawrence. Good to be here.
All right. Come on. Come clean. You were in the room with President Obama discussing health care reform, and you did, in fact, work with the Romney administration in Massachusetts. Come on, Professor. You got to tell us the truth here.
The truth is that the Affordable Care Act is essentially based on what we accomplished in Massachusetts. It's the same basic structure applied nationally. John McDonough, one of the other advisors who worked in both Massachusetts and advised the White House, said it's the Massachusetts bill with 3 more zeros. And that's basically a good description of what the federal bill did. It is kind of laughable that we've actually reached the point where we have the great investigative reporter Michael Isikoff actually going in there to get these kind of diary facts in the White House to sort of prove what we all know. I want you to listen to what Mitt Romney had to say when he was signing the bill in Massachusetts.
I want to thank the many, many people in this room who were critical to crafting and coaxing the bold health care initiative that I'm about to sign. Jonathan Gruber at MIT devoted hours and hours to an essential econometric model.
Thanks for that econometric model, Professor. He didn't mention you last night in his answer when he was asked about, who helped him and who helped President Obama.
Yeah, I'm hurt, Lawrence, but, I think I'll live.
The truth here is as simple as we make it, that there was one model in the country really to look at, an individual mandate model that the president ended up adopting after, by the way, campaigning for the presidency against the individual mandate. Hillary Clinton was the individual mandate candidate. Barack Obama was against it. So obviously the Massachusetts experience with it was part of what moved him in the direction where he ended up.
When I was advising both the Obama administration and Congress throughout 2009, the number of times I got asked, how did you do it in Massachusetts? What made it work in Massachusetts? It was the administration and Congress were taking a big leap into unknown territory, and the fact that they had that example to lean on was so, I think, comforting to them in taking that step.
Well, the big leap was done without a single vote to spare. So it is my considered opinion, having watched a great deal of congressional legislation move, that the bill would not have passed if there had not been a real-world model to point to answer many of the questions, especially about the individual mandate, that House members and senators were asking both in hearings and in panicked last-minute voting decisions on the floor. How is the individual mandate working in Massachusetts?
It's working exceptionally well. In Massachusetts, we've covered about 2/3 of our uninsured, and our non-group or individual insurance market, which was really broken, we've cut the premiums in half. So we fixed a broken insurance market and covered most of our uninsured.
And Massachusetts had a pretty high rate of coverage before you even went to the mandate. Romney makes a very strong point about the Obama bill is full of taxes to pay for it, and the Romney bill did not have tax increases in it to pay for it.
Yeah, I mean, that's just technically true, but intellectually not really straightforward. Basically, in Massachusetts, the financing for our bill came half from the federal government and half from an existing tax that former governor and presidential candidate Michael Dukakis had put in 1988 to finance care for the uninsured. So we didn't have to raise tax in Massachusetts because the money was already there. At the federal level, we didn't have that luxury. It wasn't like China was going to come pay half the cost of the Affordable Care Act. There was no bigger government, coming to help us out, and so we needed to raise taxes to finance it.
Professor Gruber, you just called it our bill. Now, Mitt Romney's not going to want you to use that phrase again now that he knows you went into the Obama White House and brought our bill to show the Obama administration how to do this. Jonathan Gruber, professor of economics at MIT, thank you very much for joining us tonight.
My pleasure.